At Hoima Regional Referral Hospital in western Uganda, Tulinawe Kabami is anxiously watching over her 3-year-old son who has been battling severe malaria for the past 5 days. Tulinawe describes the harrowing journey from a local health center to the regional hospital where her son's condition worsened despite initial treatment. He became weak one evening and I gave him medication, but he didn't improve. The next day, he fell down and became unconscious. I rushed him to the hospital where he was treated but had to be referred here due to severe conditions. Although the family received mosquito nets from the government, Tulinawe admits they have not been used. The family has already spent about $100 on treatment, but there is little improvement. The cost of treating malaria is a burden even for the government, which was told by donors in March to fund malaria fight on their own. Dr. Gilbert Ategeka, a pediatrician at the hospital, notes a troubling trend. He reports that 3 out of 10 children admitted test positive for malaria.
And people to be taught that if someone is sick in the family, there is economic cost. Children will not go to school because the money will be taken to hospital to take care of this one who is sick. So the government needs to be on the ground. The VHT should also be more encouraged, facilitated to do their work of teaching people to use mosquito nets.
While the global community has invested $3.5 billion in malaria efforts, more than double that amount is needed to meet the 2030 elimination target. With African governments already struggling with weak health systems and limited resources, this shortfall could have dire consequences.
If we look at the statistics, annually we are losing about $12 billion in terms of development due to absenteeism from work, absenteeism from schools. We see that if we go to the hospitals, a lot of the patients are children, but beside them are women, hardworking women who are not able to go to work because their children are sick. Malaria is really devastating the development of the African continent. And that's why we are saying we need to come together in terms of partnership.
Countries with the highest malaria burden are facing increased health costs and economic strain, pushing millions into poverty. A recent analysis suggested that achieving the malaria target could boost Africa's GDP by $127 billion by 2030. Razia Othman, reporting for Africa News.